I thought today's event was fabulous. It was inspiring as well as informative. It helped us to at least understand the resources that are available to us both locally, regionally, and nationally, that both as we deal with healthcare providers as well as churches, institutions, hospice care, and others, that there's a relationship that is formed that we need to be more intentional about how we use it. I happen to be in a situation currently right now as a pastor where I've had 9 deaths within the last month. I'm doing my 9th one tomorrow, 9th funeral. And each time, each family, each situation brings about our own set of situations, such as the healthcare situations that are deal with the grief that is happening with families, the dialogue that needs to happen with healthcare providers and people who are dealing with various stages of this care. And so this is refreshing to know that those resources are available, and we just have to be more intentional about bringing them together. So this has been good for me today. We currently are engaged in doing things individually. I have a healthcare ministry that's with our church. Our healthcare ministry does do the kinds of not only resourcing for our weekly servicing, the worship services, but information sharing through our Seasoned Saints ministry and others. We have a healthcare facility on the other side of our parking lot, and we have relationships that we build with them in order to do the kind of community neighborly work. But I think SEMATAC gives us a greater ability through Southeast Michigan to reach out in other ways that we could build capacity. So it's more than just bringing resources to the church, but the church can be a resource to help to be an anchor in the community to disseminate, build trust with people who don't have the ability to get this, particularly in the African American community where the health disparities are so great. It's a place of trust to come to the church, and the church be that place where people can get that information and we can be an encourager for those who need the care the most.